Sure. I'm getting a message, host disabled, participant screen sharing.
So
Just give me a moment.
Change that,
Just a minute. Just a minute. I think you should be able to share now.
Can you see it?
Coming up.
Can you see my screen?
Not yet. It's yes. So there we go.
Yeah, we can
Very
see.
good.
How's that?
Yes, that's good.
Great.
Okay. Okay, I think it's all fine.
All right. So we have about a minute to go still, and so shall we do the screenshot at least while everybody is still, preparing? Ashok, can you take it in
Okay,
gallery
do you want me
view
to
for all
stop
of us?
sharing?
No, it's fine to be on. I think it'll be nice if
Okay.
you leave it on, and he'll take screenshots as we go as well. But this
Okay.
is an important webinar, so I think it's nice if we have one right in the beginning.
You won't get a proper screenshot unless you unshare the screen, probably. You won't get all the
Okay.
participants. So I think let it be for now.
Okay, I'm going to
Rujita.
stop
Let
sharing.
it be for now.
No, it's okay, I think. Let it be. Because we're almost ready to start.
Okay.
Yes.
Rujita, at 8 o'clock, I think you can start.
Yes. So welcome everybody on behalf of the Wadia Children's Hospital and the Indian Orthopedic Association and the JBJS on this very, very important and pivotal webinar on what does it take to publish a manuscript in a top tier journal. And who better to do it than Dr. Mark Swinskovsky himself. And I am very, very glad that this collaboration as well as this generous grant has been given to our institute. And we would like to share whatever learning that we go along in this journey with everybody in the IOA. And without further ado, I will hand over the proceedings now to respected Dr. Shivshankar for his welcome address, and then Dr. Rajgopal to talk about this collaboration. And then Dr. Alaric Arujis will be introducing the speaker. Thank you.
Good evening, everybody. Welcome, Dr. Mark Swinskovsky, for this webinar arranged by Wadia Children's Hospital under the JBJS grant, along with the IOA and the IOA PG teaching subcommittee. We will be glad to hear you. Without much ado, I request Dr. Rajgopalan to proceed and welcome all the people who are attending this webinar and say a little more about this webinar. Over to you, Raja. You have to unmute, Dr. Rajgopalan. Rujita, please take over. Rujita or Alaric.
Good evening to you all.
Yeah. Yes,
Good evening
Raj
to
has
you
come.
all. Yeah. Good evening to you all. It's a great pleasure for us here to have a very eminent faculty for their second lecture of the series. Just a few words on how this all came through. The Department of Orthopedics of the Wadia Hospital was won the recipient of the Robert Buholz Journal Club Award from the JBJS Resident Education Fund. And it was extremely nice of them to have a collaboration with the Indian Orthopedic Association and the PG Training Committee of Indian Orthopedic Association to have a series of lectures by very eminent faculty on extremely important subjects of interest to the residents. And this collaboration was called Foundation Teaching Series, IOA PG Teaching and Wadia Children's Hospital collaboration. We had the first talk of this series in the month of March, and then after that we were having one more lecture later. Today we have a very eminent faculty to tell you on a topic which is very, very important today. With all of you know that the National Medical Council has now made it compulsory for all the faculty and postgraduates to have a training in the research methodology and associated topics. With that, I welcome all the members of the PG Training Committee and the President and Secretary and all other people from the IOA office bearers and the faculty, Dr. Rajitha, Dr. Alaric, Dr. Arjun, Dr. Shyam, Dr. Sujat, and also all the people who have logged in. Thank you all. Over to you.
Thank you so much, Dr. Raj Gopal, and our great respects to you and to our IOA President, Dr. Shiv Shankar, who's always been in the forefront to encourage any academic activity. He's so busy, but he still takes the time out to grace us with his presence. So thank you so much, Dr. Shiv Shankar, sir. It's also my great pleasure to welcome and to introduce our speaker for today, Professor Mark Swinskovsky. Dr. Swinskovsky is currently a professor at the University of Minnesota. He completed his residency and internship at the University of Washington. After research fellowship in Switzerland, he joined the university at Vanderbilt University. In 1988, he returned to the University of Washington and was promoted to professor of orthopedics, and then quickly assumed the position of chief of orthopedic surgery at Harborview Medical Center, Seattle, Washington. He then moved on to the University of Minnesota in September 1997, and for 10 years, through October 2007, he has held the position of professor and chairman of the Department of Orthopedic Surgery at the University of Minnesota. From 2007 through July 2015, he has held the position of CEO for the TRIA Orthopedic Center. He's a past president of the Orthopedic Trauma Association and the American Orthopedic Association. Dr. Swinskovsky is an NIH-funded investigator and has published various review articles in peer-reviewed journals on numerous topics that many of you have read on, including osteomyelitis, fracture treatment, and the assessment of various musculoskeletal outcomes. He has lectured extensively in the US as well as abroad. And we all know him since many years as the editor-in-chief for the Journal of Bone and Joint Surgery. So it's my great pleasure to welcome you, Mark. Thank you so much for accepting our invitation. And we look forward to the pearls of wisdom that you have gleaned over the years as editor-in-chief of this very high-impact orthopedic journal to share some of our views with our pediatric orthopedic colleagues and various young trainees and postgraduates who are attending this webinar. Over to you, Dr. Mark.
Well, thank you very much for that very kind introduction. And I am very appreciative of the organizing committee and the Indian Orthopedic Association for taking the time to participate in this webinar, particularly in this very difficult time of the pandemic in your country. Our thoughts and prayers are with your nation at this difficult time. Hopefully it's making a turn for the better. I have a title slide here, which is the one that I've used in many countries around the world, in places where people are looking for ways to improve their methodology so that they can publish manuscripts in top-tier journals like JBJS. But that's not what the organizing committee asked me to address. This is what they asked me to address: the scientific publication issues also on peer review and literature evaluation. So the majority of this discussion, which I'll take the next 20 minutes or so, is on research design and how to get your manuscript published. But then at the end, I will discuss issues of peer review as well as how to analyze the literature. So these are my conflicts or brief bio, I suppose, which was just a review for you. I will point out that when it comes to the topic of how to be a good reviewer, that I started as a reviewer for the JBJS in 1990. And I was then promoted to associate editor and then deputy editor. And then 7 years ago, I was asked to apply for the editor-in-chief journal. So the point being that if you do a really good job as a reviewer, eventually you will be asked to move up in your relative scholarly publication work. So our journal is very old.
I'm sorry to interrupt, but there appears to be a bit of an audio issue. At times you're quite clear, but at times your voice seems to be breaking up. So I'm wondering whether you could use your headphones. Thank you.
I can, but it'll take me a minute to go get them.
Well, now it's clear.
That's enough of a problem.
Right now it's fine, but then in between it tends to break off. So I don't know whether it's the distance to your laptop or there's some disturbance around you, but your voice is a little breaking up in between.
Okay.
Sorry about that.
Okay, well, let me know if it becomes a constant problem.
Okay.
So
It's
our
okay
journal
now.
is quite old, as you can see from this slide, and I have in front of you the new website, which has been redesigned. And I would suggest that any of you who haven't visited recently, that you should have a look. The search engine is very, very powerful and will help you find articles of interest. And also there are ways to search on images which you can use for your presentations. There's also a new feature which we call clinical summaries, which has over 130 of the most common orthopedic diagnoses that a 800-word summary is written with the most cited literature on the topic. And those are refreshed every 2 years. So it's very, very valuable for trainees to look at the clinical summaries. I want to point out that we have a strategic partnership with Ortho Evidence and Mo Bandari. And some of you may have seen Dr. Bandari and I are doing a podcast bi-weekly that we call Ortho Joe. And we will continue this collaboration as we strive to have artificial intelligence tools that will provide up-to-date meta-analyses on any topic that you desire. We can talk about that in the discussion if you wish. So here's our impact factor history of late. I will point out that of all of the top orthopedic journals, we are the only one that doesn't participate in gaming the system by writing editorials where we cite our own publications, etc. So ours is an honest impact factor. Some of the other journals play games with it, and we can also talk about that. Here is the history of orthopedic documents that are published by year globally, and you can see an increasing influence of open access articles. We started an open access journal about 5 years ago, and it is now increasing in interest as well. But you can see the explosion in the world's literature. So how is it that you can get a manuscript published? What topic should you select that would be of interest to a top-tier journal? So this is primarily for the trainees. And the major question is, does the research question have a possible impact on clinical practice regionally and worldwide? And you can identify such questions in conferences. You can identify them in the conduct of caring for a patient. You can identify them by critical reading of the journal, and you can also identify them by listening to presentations and having skepticism about what the speaker is saying. All of these are ways to refine a question that is worthy of your attention and labor to perform a research project. But once you've figured out what you would like to publish on, you need to select a journal where you would like to publish it. We are a general orthopedic journal, which publishes manuscripts of broad interest to the world community. We're not particularly interested in specialty or subspecialty techniques. We want manuscripts that have a very wide impact on clinical practice. We do publish some basic science articles, but it's less than 15%, and they have to have clinical relevance. You might choose a clinical subspecialty journal where there's a more narrow interest, and sometimes manuscripts submitted to us get rejected because the reviewers feel that it's of better interest for a subspecialty journal. And at the bottom, I note our basic science practices. So primarily, we're publishing clinical studies. There are a large number of case control studies. We like to have a control group with the intervention of interest. We also publish cross-sectional studies, which collect data at one time point to determine prevalence. And we always will be publishing cohort studies because the field of orthopedic surgery is extremely broad when you think of it, encompassing things from spine surgery to joint replacement to sport to trauma. We're a very broad field, and many times the topic you're interested in is not common enough to consider for an advanced study design, such as a randomized controlled trial. We do publish randomized trials. It's about 12 to 14% of what we publish. If you're going to publish in our journal, we recommend that you use the strobe guidelines for cohort studies or consort guidelines for randomized trials, and I'll be presenting some more information on these tools. And we like to see follow-up for reconstructive procedures of more than 2 years. And as you know, the level of evidence of a study is important because it is simply the way that you should consider the potential for bias as you review the manuscript. Here is the level of evidence pyramid, which you're all familiar with. We basically were the first journal to encompass this because of our long affiliation with Gordon Guyot and Oxford. We have been recommending this to the orthopedic community worldwide for the last 17 years, and it is broadly adopted. As I mentioned, the case series is level 4. We will always publish case series, which are primarily a rare event or rare procedure type of interest. If a control group is added, you go up the pyramid. And what we've seen in the past few years is a decrease in the level 4 submissions with an increase in level 1, 2, and 3 as our orthopedic community learns advanced clinical research design. And as you all know, higher levels of evidence are cited more widely.
Mark, I'm sorry to interrupt you again, but there's an internet connection problem at your end. So our host is asking us whether you can do something to improve that. If there's a better area in your house or office where you're speaking from that has a better internet connectivity.
Okay. I'm going to have to get out to do that. So I'm going to change to a different internet source.
Sure. We'll take a little
but I'm
break.
afraid I'm going to lose you now.
No problem. Because
what's that?
No problem. I think do whatever's required because your voice is breaking up in between. We'd rather prefer to hear your talk well. So if you get a better internet connection, it'll be great. We'll take a little break for a while.
Okay.
Rujita, if you're trying to say something, we can't hear you because you're muted.
Well, I was just requesting all others to stay muted and stay on. I think this is just a transient phase, and shortly Dr. Mark will be back. In the meanwhile, it's nice to see so many people from IOA also logged in and so many students. So please do keep your questions going into the chat box. I've also put Dr. Arjun Dhavle's number in case anyone wants to send it on WhatsApp, or feel free to send them to me and Dr. Alaric. This is really important. I think everybody's careers, really there's a make or break with publications. So let's give Mark that chance and let's listen to him out patiently. While Dr. Mark joins in, I think let's have a little bit of a show of hands by the PGs especially. What is the main difficulty that you all face in publishing something? Is it the topic, how to choose one? Or is it how to go about the study? Can you all type into the chat box? What is the main difficulty that you all face? Dr. Harshit says they think the main difficulty is in finding a topic which would be impactful. So while Dr. Mark comes in, Dr. Arjun, if you can really, kind of throw some light on this. How should they go about choosing something which would be a topic which would be impactful? Arjun?
So I think the topic which will, be impactful is actually to some extent region specific also. Some of the problems in the West and some of the problems which we encounter are different. And, so it's very important that you sort of think about what you are, you're facing, and then, how applicable it will be. So, problems in the developing world are different from what we would encounter in the developed countries. And, sometimes the treatments would differ. And that's where it comes down to, identifying the sort of problem and being able to sort of explaining it out, when you are submitting the paper, so that someone who's reviewing the paper, even in the West would sort of find this or be able to associate with the problem, because otherwise it's sometimes a disconnect, and which is probably one of the reasons that we don't see many Indian publications in the JBJS. It's sort of very centric to Western literature because it is eventually a journal of the American Orthopedic Association. But then it is obviously opening up its doors, and so we are having these sort of interactions.
Also, one more thing.
Feedback. Let's
Yeah.
ask Dr. Rajgopal, what does he feel? Because he is the chairman of this PG committee. He's been guiding PGs for many, many years in his own institution and also via IOA. So I'm sure some pearls of wisdom from Rajgopal sir and Dr. Shiv Shankar also be very beneficial.
Thank you, Alric. I totally agree with whatever Dr. Arjun said. But the other aspect is, if you consider the number of PGs today we have, number of institutions, and number of dissertations that must be going on, but the publication outcome of that is hardly anything. If you take the whole set of, suppose we take in a year, so many PG dissertations are submitted, the number is something around, if I remember right, it is easily into more than 70. This is a data which was 2011 data, 10 years old back data. At that time, it was more than 750. And if you take that, the publication conversion from that is very minimal. One of the problem is, of course, the relevance, clinical relevance of the topic. Second thing is the methodology. I think one of the problem of most of our studies are, it is difficult to get a randomized controlled trial in a thesis, but at least it could be some kind of at least a prospective study. Most of them are retrospective studies, that is number one. And the complaint by the postgraduates in many centers are only they keep on telling, like he said, sir, we are not getting good topic, there is not adequate variety of cases, things like that, which is not really true in the sense, if you look at publication alone, then probably it is the methodology, definitely a randomized controlled trial with a good methodology that has its value. There's no doubt about it. I think that is one problem, that the partly I will say the problem of, say, I will say my problem, like I am myself not very thing, I have not taken interest, I have not published, then I won't be able to guide them. That is another problem which is faced in some of the institutions. I am not saying everybody, because when it comes to review for us, even the dissertations are signed without really going through them. So I think the quality, time consumed in that, lack of infrastructure in some areas, like if they want to do a study on, let's say, animal studies, which are difficult now, but if they are going to do that, you need a good infrastructure. So these things, I think a lot of problems come in, but along with that, the interest. This is
Thank you, sir. I think that's very relevant, I think. Let's ask Dr. Shiv Shankar, because I think he's a really important person to ask this. Dr. Shiv Shankar has worked in a private practice setup, but he has come up with so many innovative and inventive technologies just to show you that, the institution is not really the most important thing. He has come out with some techniques and innovations which even large centers in India have not come out with. So, Dr. Shiv Shankar, what is your advice for PGs and for younger surgeons who work in private practice setups in smaller places of India, not necessarily in the big large cities, which churn out so much of literature? I'm sure your insight will be very useful.
Yes, Alaric, there is a unique problem in India, which is cultural problem as well as the insurance problem. Our healthcare is not insured to the extent, whereas in the West, it is totally the government or the state runs the health. So there is no problem with the treatment. Whatever is the scientific way of treating or a good way of treating, as per the book, they will be treating. But in India, our treatment is entirely decided upon by the skill of the surgeon, availability of the technology in that area, the cost involved in the treatment, the willingness of the patient to accept the treatment, and the person who is paying for the treatment. All these factors play a major role. So many a time, my innovations are due to the payment issues, because the economical reasons is the one which our patient come late. For example, recently I did one primary antibiotic coated nail, interlocking nail. If I tell that the real way of treating this is a twice surgery, first to treat with an antibiotic coated nail and then a second surgery of interlocking nail, many of my patients run away. So I had to club them and get a middle path regime like that. So this is one. But what I want to tell Rajgopalan sir is, the institution where there is continuation, the teaching staff should come out with papers and publications. So it's not easily possible in a private setup, but definitely with mobile phone, with the high-end mobile phone, you can take the record, keep the record. Now the life is becoming easy. Probably in due course of time, in few more years' time, India will have a lot of publications. I'm very hopeful. Another way is registry. So registry is something which is also very, very important, because we have so much of patients' data in India, but unfortunately we don't enter and we don't have a pool data of multi-centric studies. So IOA is coming with registry. Probably by the end of this year, we'll have trauma registry, and definitely in few years down the line, we'll have a lot of cases of different people across India treating. We pull the data and probably come out with some papers. This is what we are looking at present.
And also, sir, I think a lot of PGs tend to think that it's just because something is a large series that guarantees a sort of publication. So I think few words on that also, what would be of value? I would request you to tell us.
That's correct. Yeah. So what is more important is with whether it's a clinical relevance is one which is important. Then the rarity also, something which is out of the blue. You think something, they are the something which are useful and which can be reproduced by large number of people is something, another thing which is also very, very useful. So instead of doing a study with large number of patients, it's better to do with a short, small group of controlled patients and come out with a specific indications and a specific way of treating. Over to you, Rujuta.
Another thing I think that has changed in the last few years seems to be that any and everybody wants to publish their thesis. So there's something I think I would request Arjun to really speak on as to what is the essential difference in the training period, since you've trained extensively both in India and abroad, and how is publication taught in our scenario versus their scenario? If you could tell us that till Mark comes. I think he's just about going to be joining us soon, but if you could just tell this to us.
So the primary difference is the residency is 5 years versus 3 years. And basically 5 years is actually appropriate. 3 years is actually too condensed, considering the breadth and span of orthopedics. And there the subspecialty training is sort of given importance along with the general trauma training. And the other thing is the EMR. Because of electronic medical records, the documentation is much better than what, is kept, with us even in institutions. I believe that's changing and it will change with time. The other thing is a lot of studies are done because there's a lot of funding available, for prospective studies, etc., which are NIH funded, etc. But which sometimes we do face that lacuna and a shortfall, in sort of both documentation and in funding. But it can be sort of looked at. I think it's still possible to do it.
Yeah,
I can see Hitesh is there online, and Hitesh has got a lot of publications, not just in Indian literature, but also international literature. Hitesh, do you want to say something on this?
Yeah, thank you, Alaric. You saw me and caught me. I was about to. Actually, I log in to ask the question to JBJ's editor that why there is a publication submission charge, $250 it is there. It is very, very difficult to submit the article to the American JBJS. British JBJS, it is not there, but American JBJS, it is there. So please don't forget the question and ask him, because that is number one. What was told by Professor Raj Gopal and Dr. Shiv Shankar, everybody, it is that India faced a very different scenario than the West. See, the culture in the postgraduate in the Western countries is there to publish. There is something called as the eagerness, asking the question. Asking the question at that level, it is not developed in the Indian postgraduates. That should be cultivated. Actually, it's our duty to cultivate to the next generation, asking a relevant question, and that is clinically significant. If they are asking the question that definitely they will go for the why this is happening and why this is not happening. They will find out the answer by asking a relevant question. And as the Dr. Shiv Shankar said, that if we can able to generate the registry, the India has got the plenty of the opportunity to publish that. And one of the example, actually, I am the second time, but that Dr. Benjamin can give you the more insight on this, because if you do the work sincerely, dedicated, honestly, definitely it will get published in the international journal. There is no doubt about it. Another aspect, what the Arjun said is absolutely correct. In the Western world, they have the research assistant, they have the funding, they have the all sorts of the basic infrastructure. Publishing from India, it is not easy. Like you are doing the collaboration with a lot of registry, like the hip dysplasia registry. And similarly, we are also involved in hip dysplasia international study group, where every single consultant will have the research assistant and associate, that the most of the work has been done by them, where here it is not done by the postgraduate or the research assistant. The person has to do themselves. And the third important aspect in a research, what I can see that from our institute also, the people will say that the hard work is more, but there is no incentive for research. And fourth hurdles, what we can find out in open access journal and some of the international journal, they will ask that submission charge. If there is India can come up with the basic platform, I think we should not go for the outside. We need to have our own publication centers.
So there's some issue still with Dr. Mark's computer.
Rujita is in touch with you, or
yes, we've been on email with him.
Okay, fine.
I think he says
we'll
he's
have to try to log in, but then he cannot log in now. You know, he tried to change his settings, his internet settings, and try to get another internet connection, and now he's unable to log in. So we send him the login information again. Okay. We'll wait for a couple of minutes. If it's not, if he's still having an issue, we might have to reschedule, unfortunately. Surprising for the US for this to happen, but maybe he's in an area in his house because it's a weekend where he doesn't have good connectivity.
Yeah, correct. As Arjun rightly said, the post-graduation here in India is 3 years, and abroad it is 5 years. So what happens is the working pattern is also different, and here they slog more in those 3 years and read less and publish less. Probably the working pattern is structured in other countries. That's one of the reasons why they have good amount of time to do the research and also to publish the paper. And probably it's the 4th and 5th year is more important, because once you know little bit more about orthopedic, that is the time when you start thinking about publishing. So we don't have that 4th and 5th year available with us. And unfortunately, the 4th and 5th year, our people go for training abroad because of various reasons. And there they publish in collaboration with some of the place where they do their fellowship. So this is what I also feel. Is that correct, Arjun, what I'm telling, or do you feel it is something different?
No, I do agree. But I think it eventually comes down to the individual, you know, and it comes down to the mentor and intent. And, you know, I mean, we can give excuses, but or we can just work hard and try to get it done. You know, and there is a way, and I think it's actually about our culture. I think that the culture is like Hitesh said, you know, Dr. Joseph had a culture of publishing from before. You know, some centers have it, some people don't have it. So I think it's possible to do it if you make the effort. But yeah, I think that 3 years sometimes is a little bit difficult. I think residents there work very hard too. You know, it's very professionally run, the residency, and there's great accountability both ways.
Yes.
You know, which I think in our place, you know, we can kind of improve, I think, some ways.
Arjun, can I have a word on this? Arjun, can I have a word on this?
Yes, please, sir.
Yeah. See, I don't know how many of you are aware. Somewhere in 1977 or something, the Almia Institute, they made thesis not necessary for postgraduates. They made the postgraduation for 2 years. They stopped. Thesis was not there. And they found that the amount of publications came down markedly. Markedly means it was something like 70 to 80% down compared to before. Then after 2 years, if I remember right, 79 or 80, they reintroduced this. Why I'm saying that? Because most of our publications are coming from the postgraduate side. Either they continue it after that, or it is added by into the name of the faculty also who have helped him. So I totally agree. Why I said that is because 3 years is definitely inadequate, and first year goes in selecting the topic. Second year, he starts that and then finds that he doesn't have time to finish. Everything goes in a hurry. It's a slipshod job that finally they do because the exam comes in no time. So I think this is a main problem. The whole time factor is the main problem.
Anyway, this Indian Orthopedic Research Group and Ortho TV, mainly we are promoting our people to publish. So if you have any problem, now I assure you, all the people who are viewing, that we will help you in publication. So you can contact me or Dr. Ashok Sham in this regard, and we'll definitely get the things sorted out. This is the main reason we have come out with this IORG and Ortho TV. Our long-term aim is that India should have a lot of publications.
Publications, correct. So I think sometimes, in every difficulty there lies an opportunity. And this was not anticipated that Dr. Mark would not be able to finish his whole talk. But Arjun has a very keen interest in research and how to design. And I think he's time and again, he's taken a talk for PGs. So if he has it ready, Arjun, can I request you to screen share and take that instead? Because I think no session should be left without some gaining in knowledge.
Yeah, Mark is joining.
Oh, joining. Oh, lovely.
Yeah. Mark, you're muted.
Oh, hello. I'm sorry. My computer crashed when trying to switch over to a different Wi-Fi source, and I can't get it restarted. So I'm not sure. It's definitely a problem with my machine.
No problem. We're so sorry to hear that. But if you don't mind, Mark, we've been having a little bit of discussion in your absence, and there have been quite a few questions from the audience. So that's okay with you. We can reschedule your talk for some other time. But since you're here, could we have a few questions from the audience for you, if that's okay with you?
Certainly.
All right, good.
So Hitesh,
I think you had a question for Mark. If you can go ahead and ask him that, then we'll take it from anyone who wants to ask a question. You can just raise your hand, and then we can pose the question to Dr. Swinskovsky. Hitesh?
Thank you very much for the coming here. I have a question that is the JBJS American is a well-reputed journal, and we have also published in American JBJS. But from year 2014, the American JBJS has started an article processing charge and submission charge. Article processing charge is $2,250 and the submission charge is $250. So can you throw a light, because this would be a biggest hurdle for the developing countries, including India, for the publishing in American JBJS? Yes, thank you.
That's why we don't have a submission fee for submissions from India.
Okay. And what about APC? APC is also WIVOF?
No, the APC is still intact, and it's $22.50. But there are ways that one can request for a lowering of it, which we will honor if it on a case-by-case basis.
Okay. The question I am asking that the average orthopedic surgeon, I can reassure that the average orthopedic surgeon would not earn $2,000 in India per month. So there should be huge charge for.
I understand that,
Yes.
and that's why we will reevaluate that on a case-by-case basis.
Thank you, Mark. Thank you, Hitesh. Arjun, do you have some questions for Dr. Swinskovsky?
Yeah, so I have a couple of questions. So one is, if there is a prospective study which is planned, is it necessary to register it with the journal, like, say the NEGM, etc., ask for a prospective study to be pre-registered with them if you want to publish with them? Is that a requirement with you all, or is it okay to have this registered anywhere?
So if it's a clinical trial, we require that the trial be registered before the first patient is enrolled. And it doesn't have to be with the US trial registry, clinicaltrials.gov, but it must be registered with some national level trial registry before the first patient is recruited.
And another question I had is, how sort of in terms of a case series, a retrospective case series, how likely is it that, the journal will look at it sort of favorably, or, is it very difficult to get a retrospective case series published with you all?
Well, our current acceptance rate overall is 15%. So we publish a lot of case series, but I can't tell you how an individual reviewer is going to grade the manuscript. We do double-blinded reviews, so the author is unaware who the reviewers are, and the reviewers are unaware of who the authors are or where the manuscript is coming from. So it is solely based on the merit of the case series.
And another question I had is, if you're planning a case control study, so, where we have a series of patients and we're having a control group. Now, if it's a historical control group, is it sort of viewed unfavorably, or do you kind of look at it, like as a bias?
It depends on what the condition is. If it's a very rare condition, historical controls have been accepted. If it's a common condition, this would be very unlikely that it would be accepted. And we would always prefer concurrent controls whenever possible. But if it's a very rare condition, it may not be possible.
And the other question I had is, it's sometimes very difficult to do randomized control trials because, patients don't prefer to sort of be randomized. They prefer to have the sort of clinician's honest opinion on how the child or adult should be treated, by the treating physician. So in which case, then, the observational studies, as in, where they are selecting the treatment, what's your take on that? Because it's not that easy to do the RCTs in orthopedic subjects. So what do you feel, and what's your sort of comment on that?
Well, it is possible to do randomized controlled trials. Otherwise, we wouldn't be publishing 12 to 13% of them every year. So oftentimes that's an excuse. It's an excuse because surgeons don't want to actually admit that they don't know what the best treatment is. And my own personal experience with enrolling patients in randomized trials, if you truly don't know what the best treatment is, which is also called equipoise, patients will more often than not consent if both treatments are accepted. So in other words, we just published a 1,500 randomized controlled trial involving also sites from India on 2 ways of fixing femoral neck fractures: sliding hip screws or multiple cannulated screws. So it is possible to do it, and to say that it's impossible that's an excuse. Where there are issues with patients agreeing to be randomized, what we often do is we accept research designs where there is a group of patients who consented to be randomized, and there are a group of patients who did not, and were treated as what their preference was. And then we do separate analyses of the truly randomized and then pooled analyses of both the non-randomized and randomized. So I will say it is possible, but we also understand that observational trials based on patient selection are sometimes necessary.
Thanks, Mark. And I think one of the points in your talk that you were going to cover as well, we have quite a few young orthopedic surgeons and trainees for this webinar today. And the common question that they ask is how we actually go about critiquing an article which has been published in a journal. You know, most people, I think when they're younger, tend to go on to the discussion right away because it's so much easier to read rather than the material method, the results section. So how would you, as an editor of JBJS, recommend of a very high impact journal that a younger trainee actually starts reading?
Well, I think it's the most important to focus on the materials and methods and looking for source of bias. The levels of evidence is very, very important because as you go up the pyramid, the higher you go, the better the control of bias, treatment bias is. So for a young trainee, they should be looking at the materials and methods. What were the methods used to limit bias? So it's of course easiest when it's a randomized design. If it's a observational trial, you need to look for differences between patients treated as controls versus patients treated in the intervention. Were they the same age? Did they have similar medical comorbidities? To look at the status of the two populations, are they comparable? It's also very important to look at how the outcomes were judged. Was the interpretation of the radiograph or the physical exam done by somebody who is unblinded, in other words, knows which treatment group, because that's a major source of bias. If you have the inventor or one of their trainees of a procedure who's doing the physical exam and interpreting of the x-rays, that's an extreme source of bias. It's called detection bias. So the key for the trainee is to look for sources of bias, both in the trial design as well as in the outcomes assessment, and then move on from there.
Thanks,
Yeah,
Mark.
Dr. Mark, I
yes,
wanted to ask you a question. A lot of our juniors tend to think that, if there's a negative outcome or if there is something untoward that you report in a study, or you go back to, you kind of, your previous published result, you come back and say, no, now this doesn't work. Then that is something that doesn't encourage them to send this study up for publication. So any thoughts on that?
Yeah, we publish, I love to publish negative results, particularly for controlled trials, because that will stop somebody from repeating the exercise and for putting many more patients at risk for a treatment that doesn't work. So just because it's a negative result, that should not in any way form discourage submission. We certainly like to publish negative trials for reasons I just outlined.
So can I ask you a question? So, so what happens? I mean, just for an overview of the editorial process. So suppose the paper goes through, and one of the reviewers, sort of favorably looks at it, and one doesn't look at it favorably. Then what happens?
Well, all of the manuscripts have either I am the editor or it's a deputy editor. We have an editorial board of 16 subspecialists. So we have 2 for spine and 2 for arthroplasty. So these are individuals who are extremely experienced, who have published hundreds of articles themselves. So they look at the article at first, and in about 8% of cases, it will be a desk reject, meaning it's just not, the quality isn't there, or it's not of sufficient interest to our audience. So the other 92%, they send out to 2 to 3 reviewers. The reviewers make an assessment. If there's a disagreement, the editor makes a judgment as to whether or not it should go forward into the next phase. If there's any sort of complex statistics, it goes to one of 5 deputy editors for statistics and methodology to make sure that the analysis plan is appropriate. So it's a very, very detailed and in-depth review process. And that's the reason why we charge $250 for investigators in the Western world. It's very resource intensive and quite different than other peer-reviewed journals in our field.
Also, could you kind of throw some light on how a plagiarism check is actually done?
Yeah, there's several software tools that we use. One of them is called Crosscheck, where it basically scans the world literature, particularly focusing on the manuscripts that are in the bibliography, looking for duplication. And if it reaches a critical number, we'll ask the author for an explanation. We don't automatically assume that it's for a nefarious reason or there's cheating going on, but we will look into it. On occasion, when we are suspicious, we will ask the investigator for the raw data. And we do that a couple times a year.
Now, as you've been a reviewer for so many years, what's the time that ideally, one should take to review a paper? Sort of what is the timeline which you feel, a reviewer should give to give a, good review on a paper?
Are you asking for a turnaround time or the amount of time for the review?
No, the actual amount of time that the reviewer should spend with the paper.
Well, it depends on the research design. In general, I will make a statement that for randomized controlled trials, that design is easier to evaluate. You just look at you look at the consort diagram to see if the populations look equal. You look at the outcomes to see if blinded review has been done, etc. So that can be relatively soon. I would say it's going to be somewhere between 30 to 45 minutes for an experienced reviewer, up to an hour and a half for a less experienced reviewer.
Are there any other questions from the audience?
So there are, if you go to the JBS website, actually Professor has a lot of talks. If you go to the JBS timeline, and there are a lot of nice talks which he actually has recorded on, writing an article. So I think there's one, with him, he's talking about his first publication in the 3rd year of residency. And it'll be nice for him to kind of just probably throw some light on that. Since there are younger people here, it'll be nice to hear it in his own words, because it'll probably inspire people to look at this in a simplistic way.
Yeah. So which one was that? Is that for resident?
Right. The one, where you've talked about your first publication and, in 3rd year of residency, I think, it's in that timeline of yours. So.
So you're talking about my career in research.
Yes.
Yeah. Well, my first publication came about before my computer crashed with trying to reconnect the internet. I talked about the potential source of interesting topics, and I was in a clinic in pediatrics and saw a patient who had a tarsal coalition, and the attending surgeon who I was working with said that he found that by resecting the coalition rather than doing a triple arthrodesis, the results were quite good, and pointed out that nobody had actually ever evaluated those patients. So I found it interesting and actually contacted the patients, brought them in and examined them, and published a series of 30-some tarsal coalition resection patients. And that was my first publication. And it grew from there. I don't think everybody is cut out for a career in musculoskeletal research. I think it's relatively rare. I would say 90 to 95% of people just want to stay up to date and give good care to their patients, but it's the 5 to 8% who have sort of an innate curiosity that push them to try to learn more by examining patients or developing protocols to study a question. the researchers are the rare ones. And in some ways, I've said actually have a disease that's it's probably not treatable.
And just out of curiosity, if you could tell us how this grant has actually come about and what is the genesis of the Robert Buholz Journal Club?
Oh, thank you for that question. It was something I wanted to mention in the presentation. So Bob Buholz was a deputy editor with me for many, many, many years. He was the chair at the University of Texas Southwestern in Dallas. Bob was a trauma surgeon early in his career, and then developed an arthroplasty practice and was a big fan of journal clubs. And to this day, his spouse, Mary Beth Izaki, who's also an academic orthopedist, she's a pediatric orthopedist. They do journal clubs for 30 to 50 people in their home once per month. So because of Bob's great interest in journal clubs, when the trustees of the journal decided to sponsor residencies and training sites around the world to do journal clubs, we named it in Bob's honor. Bob unfortunately passed away at a very young age from ALS, which is a very, very sad loss to our orthopedic community. So that's how it came about. And we're so pleased that programs like yours have taken the opportunity to apply for these grants and use them to advance the knowledge of their trainees and the faculty. Thank you for that question.
Thank you, Mark. There are no further questions. I think we have had a great interaction. Despite those little bit of those technical glitches, I'm sure Mark will be happy to come back again at a later date where we can listen to his talk one more time without these interruptions. But thank you very much, Mark, for coming on board today. And a small vote of thanks from Dr. Rudrita.
Yes, thank you.
Hank, I will be glad to send you the PowerPoint presentation once I can get a computer that's working again. Yeah.
So in fact, on behalf of the Wadia Children's Hospital, Department of Pediatric Orthopedics and the IOA, I deeply, deeply thank Dr. Mark Swinskovsky and, putting up such a lovely interaction, as well as really giving us a lot of thought-provoking answers. And on a topic which is really, like you said, very few people really want to make a career in musculoskeletal research. And that is probably the way forward, because I think that only then will it open up more and more avenues and help us serve our patients better. So on behalf of both the collaborating organizations, I really once again thank you for joining us and sparing so much valuable time. And I thank Dr. Rajgopalan Iyer for this wonderful collaboration, so many of our seniors who've joined in today, and everyone who's tuned in, and Arjun for bringing up such nice issues, and Ashok as well as Sandeep for running this so smoothly. So looking forward to hearing something more from you, maybe a pre-recorded lecture or something in future. We shall work it out. We shall certainly work it out. And a very personal thank you so much for this grant. Our department has surely benefited, enriched, and all our PGs are on board just now. And really very good insight from you, Professor Mark. Thank you so much.
Well, thank you for the kind invitation, and I apologize again for the technical difficulties.
Thank you. Have a nice weekend, everyone.
Bye-bye. Stay safe.